I am Dr. Rachel Corradetti-Sargeant. I am a fertility-focused naturopathic doctor practicing out of Conceive Health at Niagara Fertility in the Stony Creek area. So I think one thing to address first and foremost is that male factor infertility, sperm quality issues are really involved in a lot of infertility cases overall. And so we can see that 40 to 50% of infertility cases do involve some degree of sperm issue. And really, when we're talking about concerns with sperm quality, we're talking about potential issues with count. We're talking about issues with motility, how well the sperm is swimming and able to get where it needs to go. And then when it arrives at its destination, is it able to do its job, which can sometimes come down to the shape of the sperm, or morphology is what we refer to it as. So when we look at, what are the reasons behind this kind of damage, certainly there are more physiologic concerns. So I'm sure people have heard of things like a varicocele. There are some genetic contributions that can occur. Prior infections can definitely impact things. But then, of course, there's also this lifestyle concern, this environmental concern in terms of toxin exposure that is part of the conversation when it comes to impacts on sperm quality. So when we're assessing for why a patient might have issues, it's certainly not just one single thing that I'm keeping in mind. It's a whole bunch of things that I keep in mind when I'm assessing a patient. So another question that came in is, can you get a normal sperm analysis and could there still be a problem even if it is normal? And so this is interesting because it really brings up this topic of, DNA fragmentation. Is there an issue with the quality of the genetic material within the head of the sperm? And a normal sperm analysis won't show that, right? A normal sperm analysis is going to tell us about count and motility and morphology and some of the things that I just mentioned, but those things could look normal. And I've certainly seen that with, sperm analysis that's hit my desk and all looks good. And then later on, they get a more advanced assessment done that includes DNA fragmentation. And we actually do see that there's a problem with the genetic material. There's, fragmented DNA. So yes, you can have a, quote unquote normal sperm analysis, but you could still be missing a piece of the puzzle if that DNA fragmentation hasn't necessarily been assessed. So how long does it actually take to improve sperm quality? And I think at this point, a lot of people are fairly aware of the fact that we want to give it a minimum of 3 months. It really comes down to that timeline with respect to spermatogenesis, as well as, maturation. So it takes time for the quality of the sperm to improve. So if we think, here we are coming towards the end of July, any changes that would be implemented at this time, we're looking at seeing corrections around the end of October or after that. And that's certainly what I see clinically, that when, we implement changes for patients, it does take a couple of months before we start to see those changes play out in a positive way on a repeat sperm analysis. And certainly there are cases where it has taken a bit longer than that. So it's that 3-month timeline is a minimum that I tend to keep in mind. So some of the things that men can do to improve sperm quality. So certainly there is importance around lifestyle factors, right? So we talk about improvements with diet. And I personally like to steer away from, that superfoods, must be this food, only this food, that's going to fix it all. Really, overall, we're trying to improve the diet as a whole. Can we focus on antioxidant rich foods? Can we talk about, essential fatty acids and improving those in the diet? A lot of those foods are going to serve patients well in terms of getting a lot of the micronutrients that they need to help with sperm quality. I certainly look at other things with my assessments for patients in terms of specific nutrient deficiencies where we can get impact. I will look at it, are we missing specific nutrients? Are there nutrient deficiencies like vitamin D, for example, right? We know that achieving adequate levels of vitamin D with serum testing can certainly impact what's going on with sperm quality. So that's really important to consider. Another thing that is, I think, getting a lot of attention right now is mindfulness around heat exposure. And so, just to put some specifics around that, Certainly, there are some forms of heat that are more problematic than others, according to the evidence. So certainly things that I screen for when I'm chatting with patients is, well, are you spending a lot of time in hot tubs, hot baths? Are we in a situation where you're going through extreme heat exposure in your work environment? Those are some things that we can, talk about with patients. There's a reason why the testicles are outside the body and the sperm needs to stay cool for exposure to toxins, primarily from substances. So, certainly a hot topic most days in the clinic is how much alcohol are you drinking? Are you using cannabis in any form? Are you smoking cigarettes? All of these things can impact, and they're not necessarily the fun things. Those are some things to think about. What's going on with the diet? What's going on with heat exposure? Are there nutrient issues at play? Are there toxins that the person is being exposed to from substances? We do think about, of course, environmental toxins. That is certainly important. There's a great book by a researcher named Shanna Swan called Countdown, and I think some of her material was highlighted in the Netflix documentary that came out all about plastics. So that's certainly a topic, right? Then something I'll screen my patients for is, okay, well, what's going on with your plastic usage? What's going on with your personal care and your cleaning products in your home environment? And I'll even talk about exposures in the workplace, right? Especially in my area here in Stony Creek, very close to Hamilton. We have steel refineries, we have a lot of wineries and farms nearby where certainly patients are potentially being exposed to issues within their work environment, as well as, toxins that are being used for farming practices. So those are a couple of things to be aware of. So there's a question that came in about, what can you be doing to prepare when you're thinking about trying to conceive? I think a lot of the things that I mentioned prior to this are really important there. There are definitely some things that are out there with respect to supplements that can be helpful. So some of the ones that you'll hear about most commonly are things like coenzyme Q10. There's a decent amount of research support behind that. We'll hear about zinc and folic acid as important, selenium, L-carnitine, alpha-lipoic acid, and a lot of these you'll find in some of the products that are out there, some of the combination products that can help with sperm quality support. So those are a couple things to think about. I already mentioned focusing on omega-3 fatty acids, especially from the diet, ensuring that we're reaching adequacy with nutrients like vitamin D. But I do find it tends to be a multifactorial approach when we're working on improving these things for patients. With respect to the question that's just come in around age and whether or not that matters for male factor issues, certainly there is a component there. It is, I like to say, more like a slope as opposed to a cliff. So, we don't get this like extreme drop off. Perhaps if we compare it to the female side of things in egg quality, most people are aware that past 35, there does tend to be a sharper drop off in terms of egg quality and quantity. It's not quite as sharp on the male side of things. It tends to be that we're starting to see changes, like gradual declines in sperm quality past the age of mid-30s for males. Past 40 is when we can start to see some more concerning changes with DNA fragmentation. And then, of course, there's also the testosterone component too, because that can start to decline with age. So that's, a great place where we can work on making change, even when we talk about some of the things out there that can help with testosterone improvements. Ashwagandha is something we discuss commonly in practice, even weightlifting is something that can help with that too. So acupuncture is another thing that we offer at Conceive Health, and we do use it to help with sperm quality as well. So that's another thing to consider when you're factoring in all of the many options that are out there for helping with sperm quality. But I think the moral of the story is there are options. It's, by no means a situation where when you find out that there's a concern with sperm quality, that there's nothing that can be done. In fact, because, we can see a change with sperm within a couple of months, it can be really encouraging for patients to get started with changes and then take a look and see, is it working? Is it helping? And we can look at that. We can look at it fairly quickly. And then if there's still a concern, then we can make changes. We can look in a different direction. Thanks again for joining me. My name again is Dr. Rachel Corradetti-Sargeant. I'm part of the Conceive Health team at Niagara Fertility.